So if there's a history of bipolar in the family or a strong history of anxiety or depression, that's a predisposing factor. And they may not feel like it's relevant, or they may not even think to bring it up, right? And then any medical history in the family, you want to be sure that you're paying attention to those things in terms of risk factors. So that could, just ask, do you have any medical issues in the family that you're aware of? Heart disease, diabetes, cancer. Um, and then usually if there is, people will know about it. And it's again something that would be easy for them to forget to mention unless you ask. And then equally important is history of mental illness in the family. So if there's a history of bipolar in the family or a strong history of anxiety or depression, that's a predisposing factor. We need to know about that, so we can list that out as a risk factor, okay? Especially if there's a strong history, for example, of bipolar disorder, and you're talking to uh, an 18 or 19-year-old who's experiencing high anxiety and mood swings, you should, in the back of your head, be thinking, this person could be looking at having their first manic break at, you know, 20 to 23, and that's something to look for, because stress management is going to be a really important part of the treatment plan.